Hi and welcome back to my channel. My name is Ashley. I'm an exercise physiologist, and today I'm going to talk to you about high blood pressure and how we can lower it naturally. So blood pressure is the pressure, or the force that is pushed against the artery walls when the heart pumps and pushes blood throughout the body. So high blood pressure is typically characterized as anything over is 130 over 90, that's systolic over diastolic blood pressure. A normal blood pressure usually falls within 120 over 80 or below. We also don't want to have too low of a blood pressure. We can talk about that at the end of the video as well. But for high blood pressure, the systolic blood pressure is going to be the first beat that you hear when the heart is beating basically, and then the diastolic is when the heart is relaxing. So we want to make sure that that blood pressure is 120 or 80 over 80 or below. It used to be 110 over 70. They changed it a couple of years ago back to 120 over 80. So you have a little bit of wiggle room there to be healthy with that blood pressure. Okay, so some things that can contribute to high blood pressure obviously are going to be stress and chronic unhealthy lifestyle choices. But really you want to decrease the amount of sodium in your diet. And it doesn't mean that you shouldn't have any sodium, because we actually need sodium. Salt or sodium is very good for our cells, and it creates action potential within our cells. So we do need salt. However, if you are eating a lot of packaged or canned foods, processed foods, you're going out to eat often, those foods have a lot of salt, like an immeasurable amount of salt, just so many milligrams of salt, sometimes over 2,000 milligrams in one meal. Okay, so we want to try to eliminate excess salt, but not eliminate salt, because we do need salt, a little bit of salt in our diet. Okay, make sure that you are exercising, and it could be just as simple as taking walks throughout the day to lower that blood pressure naturally. What it does is it helps relax the blood vessels in the body and get new oxygen into your brain, and also just, being out in nature too will help you just your mind to relax. And just be. So we want to make sure that we're getting some outdoor time and some walks in addition to exercise. Okay, so blood pressure that is too low is going to be anywhere probably under 100. 100, say over 60 is going to start being on the low side, and anything lower than that is kind of dangerous. You want to make sure that your blood pressure is at least 110 over 70 and then regulate it that way. So there's a lot of research done on exercise and how it affects the blood pressure. I'm going to post some articles below. You can look through those. But basically, the research shows that moderate intensity exercise will lower blood pressure significantly, and vigorous is good as well. You can challenge yourself a little bit, but you want to always listen to your body, pay attention to your symptoms, and definitely with cardiovascular exercise particularly, you may feel some shortness of breath, you may feel some chest tightening, but those things aren't necessarily going to be bad or indicative of high blood pressure. If you're worried that you might have high blood pressure, what you can really do is just talk to your doctor about it, maybe take your blood pressure throughout the day and see what it is. Some people have this white coat syndrome, so where you go to the doctor and your blood pressure is like super, super high, but if you take it at home and it's consistently not high, then you really don't have high blood pressure. We're more concerned about what your blood pressure is consistently than what it is one time, because white coat syndrome is really, it's a thing. Okay, so you want to manage your blood pressure, especially if you're older, over the age of 50. Start getting into the habit at least once, maybe once a day or once a week, depending on how you feel, and then try to push yourself in the gym. Again, if you have questions about how hard you should be working, you can always use that heart rate formula that I've mentioned before. It's 220 minus your age, and then you want to multiply it times the intensity that you want to work. So 85% of your heart rate max is a good place to shoot. So you just do 220 minus your age, and then multiply that number times 0.85, and that's going to be your number to shoot for, 85% of your maximum heart rate. Okay, and heart rate and blood pressure, they do coincide. As the heart rate elevates, the heart is beating faster in order to pump blood throughout the body, and then the blood pressure should come up as well. Different medications may control for blood pressure and not for heart rate, such as metoprolol is specifically for the heart rate, and then there's certain blood pressures that will not, medications that will not affect the heart rate. So if you're on medication, maybe that will not necessarily apply to you. And also, you never want to stop taking your medications if you want to manage your blood pressure naturally through exercise or any other avenue. You always want to keep your doctor in the loop and talk to them about what you're doing and how you want to go a more natural route. So high blood pressure is one of those things that is somewhat easily managed through diet and exercise. And if we can get it at the right stage and early on, and then and assess it through those, and apply those measures to it, you can really reverse it in so many ways. I see that at my job all the time. It's the first thing that people decrease is the high blood pressure, and they're always so surprised. But that's what it does. Okay, diet and exercise, healthy diet. Okay, so some natural things you can take to lower blood pressure. Beets have been shown to lower blood pressure. This is just like, maybe you can get an organic natural beet juice at the store. I think it's Lakewood Organics may have one, or you can just eat beets at home. I will tell you, if you overconsume beets, you're gonna have a little bit different digestion, so you don't want to overdo it. But that will definitely help with the oxygenation of your cells, your blood cells, and also help decrease that blood pressure. So in the mornings, you can take like a teaspoon or a tablespoon of beet juice. And I am not a doctor. I'm not a pharmacist. I don't have a degree to be able to prescribe things for you. So please, this is just advice from me. As I said, I would definitely consult with your doctor before attempting to get off your medications or switching to using supplements instead. Before you do that, definitely keep your doctor in the loop. And if your doctor isn't helping you or guiding you to a more holistic way of approaching a situation, go out and try to find another doctor and ask them questions. And it doesn't necessarily have to be a holistic doctor, but maybe one that is just more interested in helping you heal rather than prescribing medications. I say all the time that doctors are kind of like drug dealers in a way. Not all, but some. So you want to make sure that you find one that really cares about your health and that is suggesting, a good indicator would be if they're suggesting a healthy diet and physical activity. So if they ask you how much you're exercising, they may be really wanting to help you as opposed to just doing the prescriptions for you, okay? All right, so we talked a little bit about the low blood pressure, obviously the high blood pressure, things that can cause it, and I had mentioned salt, sedentary lifestyle, sugar, a high sugar diet can definitely cause it. Also caffeine. Caffeine can really cause a lot of anxiety, withdrawal symptoms from the caffeine, and also high blood pressure. So I see all the time people that come to take their blood pressure in the morning. I ask them if they've had coffee, and they said yes, when the blood pressure is high, and we can usually tell if they've had that coffee. Okay, so that's one thing you can also look at. And also, stress, sometimes stress is there, we have stress, and I just challenge you to look at your stressful situations or the stress in your life with a different perspective. Maybe look for something that you can learn through the situation. My stress comes from driving. I live in South Florida, so you have to be offensive and defensive, and I feel that a lot of my stress comes from that. So that's something that I'm working on. If you want to mention in the comments something that stresses you out or maybe causes you high blood pressure you feel, you can write that down, and we can kind of set a point to pray about those things and ask God to help us to work on those things so that we can be healthier and just live freer and just more low blood pressure lives, right? Okay, so that's pretty much it today. You know, you can try the beets. There's a lot of herbal supplements out there that are recommended for blood pressure. I would just say be careful with that. A lot of supplements are not regulated, and there's not enough testing done past 3 months to know if they can be consumed long term safely. So just be careful with that. If you're consuming too many beets, you're gonna know it. As I said, with the digestion, okay, deep breathing also helps, and then trying to address any underlying anger in your life is going to be helpful as well, and allowing yourself to cry when you need to, which isn't always as easy as it sounds. Try not to hold in any pent up emotions, sadness, and just make time for yourself to be alone, to be still, and to talk to the Creator, and just be reminded of why we're here, who you are, and that you are well taken care of. All right, so thanks for watching. Have a great day, and I'll see you guys in the next video. I'm gonna be giving you some updates soon on my eczema situation. It's getting better. I've been taking apple cider vinegar and just applying castor oil, and so far that's been working for me. And yeah, we'll talk a little bit more about it in the next video. Have a great one. Bye, guys.